Guys, welcome back to another lecture of Dental Pathshala where we help you understand and learn dentistry better and easy way. And this video is an express revision course for endodontics. So let's get started with it. Today's topic will be covering about the diagnostic test. So the traditional tests like electric pulp test, cold test, and the advanced diagnostic test we'll be covering in the today's lecture. So let's get started. The first advanced test we have is the zero radiography. So if you have ever been to any of the x-ray in a hospital, if you have ever seen or done the x-ray, they carry these plates and they put this plate underneath the body part and then they project the x-ray radiation. Then this plate is going to put under the light rays and then it transfers the image comes very slowly on the computer screen. So that's a photographic plate, or we can say a zero radiographic plate. This plate contains selenium or aluminium coating, so that is why it is known as a selenium aluminium coated photographic plate. And this is basically similar to a Xerox machine, wherein how you get the Xerox, the same way you get the image on the computer screen due to the electrostatic discharge in response to the X-rays. So the added advantage of using the zero radiography is the edge enhancement effect of this technique, and it is eco-friendly since you can use this plate multiple times. Also, the radiation exposure to the patient is reduced to 90%. I'm sure you people must have seen the RVGs. So RVGs are the radio visuography, as the name suggests, radio, visio, and graphy. So radio means that conventional X-ray unit and the oral sensors. So for RVG we use the exposure time short. Visual word means that it is going to give a visual response. That means it is going to give the image. And graphy means the digital storage apparatus that is connected to the computer. Radiation exposure is reduced to 80% for RVG. It is reduced to 90% for the zero radiography. Coming to digital subtraction radiography, as the name suggests, it is going to show a digital image. As the name suggests, subtraction means it is going to subtract two images. So the difference is going to display, as you can see, we have image A, image B, and image A is subtracted from image B, and you can see the third image, which is the C via a digital subtraction. So whatever this image with the C, which is the subtracted image, you can identify the changes. So that is, you can compare it before and after the treatment, or you can see the successfulness of the root canal therapy, because any part which is left in the canal will be visible. Also, you can use this machine in diagnosis of incipient caries lesion or any periapical lesions. Basically, it is going to cancel out the complex anatomic backgrounds, and it is only going to display against this natural background the area under the focus. So it is going to remove all the unchanging background distraction and only see the changes. So that is subtracting out from a pair of X-rays. So it is displaying only the area that is changed. So that is why it is an image enhancement method. So it can be used in various purposes. So that's a digital subtraction radiography. Then coming to MRI machine, we know that MRI, we cannot wear any metal thing inside this MRI machine. So metallic restoration, ortho appliances, and any of the jewelries all are removed before the MRI, or if the patient is having a cardiac pacemaker, cannot enter the MRI. So MRI is for soft tissues, CT is for hard tissues. So MRI is going to distinguish between the blood vessels and the nerves from the surroundings of tissue structure, and it is best used in dentistry for internal derangement of the temporomandibular joint. Say suppose this is the glenoid fossa, then we have the condyle, in between we have the articular disc. So any abnormality in the articular disc, since we know it's a soft tissue, so any abnormality such as disc displacement, usually which is present anterior medially, so anterior medially is going to be this side. So generally it is anterior medial in direction. So any abnormality in the articular disc will be visible in the MRI. So it is used for, in dentistry, it is used for internal derangement of the TMJ. Now, coming to CT, we know it's used for hard structures. So computerized tomography blends with the concept of thin laser radiography with a computed image. It is going to display the image on a computer screen. It gives a three-dimensional view of everything. So if when we are seeing the CT of a root canal anatomy, then we can see the image of 3D. We know it, when we are talking about the mandibular central, we know it's wider labiolingually. So like that we can see. And narrow mesiodistally, so it can give us a three-dimensional image. Also for the root canal anatomy. In fact, the root canal anatomy is better viewed with a CT. Also, CT is used for implant purposes, so it helps in detection of the carious lesion as well as extension of the maxillary sinus. Along with that, it is used in determining the buccolingual and mesiodistal width of the teeth and of the canal anatomy also, presence or absence of the root canal filling material or any metal post. Coming to the laser Doppler flowmetry. Now guys, there are two true vitality tests. Only two true vitality tests, a laser Doppler flowmetry and the pulse oximeter. That you have to remember it. Rest, all the traditional vitality tests are not the true indicator to detect the pulp vitality. So there are two tests that indicates pulp vitality truly. That means true indicator of pulp vitality is the laser Doppler flowmetry as well as pulse oximeter. So laser Doppler flowmetry works on the Doppler principle. That means it is going to detect the frequency. So when the RBCs are moving in the blood vessel, they are going to catch the moving RBCs and then they reflect this. So that is based on the Doppler principle. So it's a non-invasive method. We don't have to do anything. We just put this light. It has two kinds of light. So detector is going to project the light, source is going to project the light, and detector is going to see the moving RBC, shift in the frequency of the light which is reflected from a moving RBC or any moving object per se. So advantage of using this technique is that it is reproducible. Every time you see the reading, you will get the same values. Also, it is highly accurate and it is useful for early trauma, wherein in traumatized patient we cannot perform any traditional pulp vitality test like EPT or cold test. So in that case we can use the laser Doppler flowmetry. Also it's a non-invasive method. But the disadvantage of using laser Doppler flowmetry is that it's a time consuming process. It may take 1 hour. So if you use a custom jig, you can make it quicker. Now talking about pulse oximeter. I hope that you must have seen a pulse oximeter. So if you put it on a finger, it is going to tell the oxygen saturation as well as the heart rate. We also use this pulse oximeter which we have used in the finger on a teeth surface. So out both the surfaces we put the pulse oximeter. So one on one side on the labial, another on the lingual, and it is going to reflect the light. Red light, it is going to reflect, tell us about the oxygen level hemoglobin. Infrared light, it is going to detect and tell us about the unsaturated hemoglobin. So it is going to measure the oxygen saturation based on the non-invasive principle, and the law we have is the Beer-Lambert law. In that we have two laws, the Beer law and the Lambert law. So Beer law states that intensity of the transmitted light exponentially decrease as the concentration of the substance increase. Lambert law states that intensity of the transmitted light, see guys, we are going to see the intensity of the light that is transmitting out from the device, and this intensity of the transmitted light will decrease as the exponentially as the distance traveled through the substance is increased. So if the substance is moving very fast or the distance traveled by the substance is longer, then the light which is transmitted will be decrease in the intensity exponentially. So basically the pulse oximeter is going to measure the oxygen saturation. Yeah, if you are using it in the finger, again it is going to tell us. If you are using in the teeth, it is going to tell us the oxygen saturation in the pulp. So it's going to tell us about the vitality of a pulp by measuring the light transmission through the pulsatile tissue bed, through the RBCs. We have other recent advancement. So remember, there are true vitality indicators. So true vitality test indicators are two: the pulse oximeter as well as laser Doppler flowmetry. So these are the true vitality test indicators: pulse oximetry and the laser Doppler flowmetry. So pulse oximetry works on the Beer-Lambert law and laser Doppler flowmetry works on the Doppler principle. Other recent advancement we have electromagnetic flowmetry, xenon 133, dual wavelength spectrophotometry, transillumination with the fiber optic. This will be covering in the cracked tooth syndrome. So measurement of the tooth surface temperature and plethysmography. So talking about the traditional pulp vitality tests, we have the electric pulp tester, also known as the vitalometer. So it is going to tell us the pulp vitality via electricity. We are going to pass electricity across the tooth, and if the tooth responds to electricity, we call it a vital tooth. That means the tooth is alive since it can hold the shock. It can feel the shock sensation, the electric current. If the tooth is not responding to the electric current, then we say the tooth is dead, or we can say the tooth is non-vital. So electric pulp testing, if it is positive, means the tooth is vital. Negative means the tooth is necrosed or non-vital. It is stimulated by the A delta fibers, which are myelinated fibers. And the electric pulp test tells about the vitality sensory fibers present in the pulp. But it doesn't tell the vascular supply. Actually, vascular supply is the true indicator, and that's the reason we call the true vitality test our pulse oximeter and laser Doppler flowmeter, because they are based on the vascularity of the teeth. While on the other hand, the electricity current, tooth is responding via the nerve supply. So nerve supply isn't the true indicator, and that's the reason we call the electrical pulp test is not a good indicator, because it is based on the nerve fiber supply, not the vascular supply. Also, it's an electric instrument, so we cannot use in the patients with a cardiac pacemaker. And the response of the electric pulp test to a person is via a subjective response. That means once we start giving electricity, then we start increasing electricity slowly, and we stop at a point when the patient feels warm or tingling sensation. So it varies from person to person. Say suppose if the patient has taken painkiller before coming, since the patient was already having toothache, so he took a painkiller, and then once we start with electrical pulp testing, it is not going to give us a good result, accurate result. So that's the reason it is not again a good indicator. Then the most important reason is that it is not based on the vascular supply. Instead, it is based on the nerve supply, so the sensory fibers. So it can also give a false positive as well as a false negative. Now let's understand the term false positive and negative. Now, as the name suggests, false positive, break the term. False means the value is not correct. Positive means it is showing the pulp is vital. So false positive means when you are doing test on a tooth, the tooth is responding to electricity, but the values are false. That means if you are exposing a tooth with electricity, the tooth is going to give us painful response. While on the other hand, actually the tooth is dead. Actually the tooth is non-vital, but it is still responding to the test. So that means if this probe tip has touched anywhere not on the tooth, So if it is accidentally touched on the gingiva, then also the patient will feel the electricity even though the tooth is non-vital. Or if the tooth is not isolated properly or dried properly, or if there is in a multi-rooted tooth a moist necrotic pulp, or if any of the root is having a vital pulp tissue, rest all the roots are non-vital, so that can be necrobiosis. Or also if there is pus filled canal, even though the necrotic pulp is there, but because of the wet canal or the pus filled canal, it can show the electric current. Also, a nervous patient can, because of the fear, can tell that the person is feeling pain even though the pulp is non-vital. So there can be false positive response wherein the tooth is actually non-vital but the patient is still responding. That's the reason we are telling it's positive. That means the patient is still responding, and the reading is false because tooth isn't vital, tooth is non-vital. Coming to the false negative, break the term and then let's understand. False negative means the patient is giving a negative response to EPT, but as the name suggests, it's false. That means the tooth is actually vital, but it is not responding to electric current. Therefore, it is showing a negative response, but the results are false. That means a tooth is vital, but it is not responding to electric current. Per se, we can say the patient has taken painkiller, so he doesn't feel any electricity, mild electricity, but still the pulp is vital. Or if the patient has undergone a recent trauma within 1 to 2 weeks, we see the shock or stunned pulp. Actually, after a trauma, we wait for at least 6 weeks of time before performing any vitality test. But you can perform the laser Doppler flowmetry. Or if there is excessive calcification of the canal, now what happens? Say, suppose this is the pulp chamber, and here we have the tooth. If the canal is calcified, and if you try to pass electric current, the current will not reach the pulp because of the calcified tissue, hard mass of the calcification of the canal. It will not let the current pass through the pulp, and the patient will not feel any painful or electric stimulus. So that's the reason it is giving a negative response even though the pulp is vital. Or if there is extensive restoration with having a thick base, so again the same goes, the base is not allowing the electric current to pass through the pulp. Also, if the patient had any sedative or painkiller before performing the EPT test, or if you are doing EPT test wearing a gloves, there is break in the circuit, saliva on the tooth, secondary dentine, or if the toothpaste which you are using is non-conducive, or if there are dead batteries, that can also cannot produce the electric current. So these are few false negative. So if you see, false positive means the pulp is necrosed but it is still responding. That means either it is moist necrotic pulp, or one or other canal is necrosed and the other one is vital, or if you have accidentally touched anywhere other than the tooth, or if the patient is a nervous patient. All these things can be asked separately, specifically in any of the questions. False negative, see guys, it is very important that you understand and learn the false positive and the false negative, because certain times it is asked in the question. False negative is when the pulp is vital but it is not responding. Either the pulp is traumatized, or any calcification or thick restoration is restricting the current going to the pulp, or if the patient has taken any painkiller, that's the reason the patient can't feel any pain. Or if there is no current flowing, that means there is no circuit. If you are wearing glove, or if the batteries are dead, or not using a toothpaste, so that means the current itself is not flowing. That's the reason the patient can't feel it. So any of the reason can cause a false negative result. Now, what happens when the patient is having acute pulpitis or hyperemia of the pulp? Pulpitis, the periapical disease and the pulpitis we have already covered in the previous part. So acute pulpitis means there is increase in the vascularity due to inflammation. That is hyperemia of the pulp. Since there is increase in the inflammation, so that means the tooth is going to respond to a lower level of current. So that means, say suppose if you are doing a EPT in a control teeth, if it is showing a value of, say suppose 25, right, in a normal contralateral or the control teeth. But when you are performing electric pulp testing on a tooth with having acute pulpitis, it will show painful stimulus only at 10. So that means the value is lower. That means the patient is having acute pulpitis. If the tooth is not showing pain at all, even if you have increased up to 75, say 80, even then the patient is not showing any painful response, that means EPT test is negative, the tooth is necrosed, or either the tooth can have abscess. In case if it is showing a current value of larger, say in a control teeth the value is 25. For example, if the value for electric pulp test, the patient feel electric current on 50, that is increased level of current, the patient is showing painful response, that means the patient is having either chronic pulpitis or irreversible pulpitis or a pulp polyp, which is also known as chronic hyperplastic pulpitis. So in a nutshell, if the tooth is giving early response to electrical pulp test, that means the tooth is having reversible pulpitis or hyperemia of the pulp, or we can say early reversible pulpitis. If the tooth is showing late response to electric pulp test, that means it is showing more level of current than normal. That means the patient is having late irreversible pulpitis. So that is how the tooth responds. Now coming to the other pulp test, that is a hot test or a cold test. Both works on the hydrodynamic theory in the dentinal tubules. Now this test is based on the nerve fibers again as well as the subjective response. So when you expose the patient or the tooth to either a hot stimulus or a cold stimulus, the patient is going to respond according to the stimulus. So it is a subjective response. The patient will tell if the patient feels hot or cold or any sensations on exposing the to hot or cold. So therefore, it's a pulp sensibility test, since it is giving a subjective response based on the subjective response. So heat test, cold test, electric pulp test, or test cavity. In the test cavity, without LA, we start preparing the tooth. So if the tooth is giving false positive, while doing a test cavity preparation, the patient will feel pain. So that can tell us about the false positive values. So that is how we perform all these tests. So that's the reason we tell that true vitality test indicator are only pulse oximeter and the laser Doppler flowmetry. While on the other hand, heat test, cold test, electric pulp test or test cavity are the sensibility test, since they are going to respond to the subjective response. So testing the vitality of a crown, how do we test the vitality of a crown or a cap or a full coverage crown? We take a burlue disc and then we start running it against the metal crown. That means we are producing a dry heat, like the kind of heat which we use in the hot test, but we are not doing a hot test. Or you can also do a test cavity. So performing a test cavity in the crown can, if the patient feel pains, that means we can tell about the pulp is vital. So electric pulp test, hot test, cold test are ineffective for the full coverage crown. So either you can do a test cavity or you can do a disc against the metal crown. Now coming to the cold test. Among all of these tests, traditional tests like heat test, cold test, electric pulp test or test cavity, the cold test is the best indicator to tell the vitality of the pulp. I mean, not the best, it's the most accurate to tell the vitality of the pulp. But the best or the true vitality indicator are laser Doppler flowmetry and the pulse oximeter. So remember, the true vitality indicator are pulse oximeter and laser Doppler flowmetry. And next comes the cold test, which is next most accurate. So cold test, in which we expose the tooth to a cold stimulus. Either it is endo ice or cold water, ice sticks, carbon dioxide snow, dry ice, or ethyl chloride snow. So basically, we don't use this cold stimulus directly on the teeth. We put this endo ice, we spray it on the cotton palette, and then we apply this cotton palette on the teeth. For anterior, we use the incisal 1/3. For posterior, we use the middle 1/3 because it is closest to the dentoenamel junction, where we have the dentist network of the nerves. So the endo ice, which is composed of difluoromethane, uses the temperature of minus 30 degrees Celsius, while dry ice uses the temperature of minus 56 to minus 98 degrees Celsius. Now, the most accurate among all the traditional vitality of the pulp is the cold test, but the best is pulse oximeter and the laser Doppler flowmetry. Now, the disadvantage of using a cold test in a crown is that it may cause crazing or even damage to the ceramic crown, and that's the reason I've told you heat test, cold test are not used, or electric pulp test are not used for crowns, for full coverage crowns or caps. So the temperature which we take for the cold test, so what is the ideal temperature or the preferred temperature we take for the thermal test is, for heat test we take 65.5 degrees Celsius. For cold test we take 5 degrees Celsius. So the preferred temperature for heat test is 65.5 degrees Celsius. For cold test it is 5 degrees Celsius. And also remember, the confirmatory test for the vitality is the test cavity. So test cavity is the last resort to check the vitality of the pulp. So that's about the diagnostic test in endodontics. I hope that you have enjoyed the video or understood it. You can also check out the link in the description box below to read the notes of this particular lecture. Or also you can check out our website www.xtooth.com for reading more interesting notes. To understand the concept better, you can also watch the multiple choice question series, which you can check out in the playlist of our channel. If you have enjoyed it, do comment in the comment section. So guys, till then, keep reading, keep learning, stay motivated. I will see you soon in the next lecture.